everyone, welcome to my channel. Smoking is a habit which is present since many years worldwide and its impacts are deeply destructive. In today's video, I'll be talking about the effects of smoking on health, how to quit smoking, how to cleanse and heal your lung after quitting smoking. So without any further delay, let's get started. Effects of smoking on health. Cigarette contains over 4,000 chemicals which are addictive and harmful to the body. Nicotine is a primary addictive substance, making people difficult to quit smoking. Other chemicals like tar, ammonia, formaldehyde, carbon monoxide has its own toxic effects. First one is effect on respiratory system. So the primary organ which is affected in a smoker is the respiratory system. It damages the cilia of lungs and later leading to diseases like emphysema, chronic bronchitis and COPD. Also, it is a leading cause for lung cancer, which amounts to 85% of the cases worldwide. Second is cardiovascular system. Even the heart and blood vessels are affected. It makes the blood more thicker and hence increasing the risk of clot formation. It increases the risk of heart attack, stroke and peripheral arterial disease. It increases the blood pressure, also increases the heart rate. Third one is it weakens the immune system of a person. When the immunity of a person is reduced, then it becomes difficult to fight against infection. Smokers are more vulnerable to develop diseases like pneumonia and influenza, and healing in them is slower when compared to that of non-smokers. Fourth one is cancer. So as I've already mentioned before, smoking is the main cause for lung cancer. Not only lungs, it can cause cancer of various other organs in the body such as cancer of mouth, throat, esophagus, stomach, pancreas, liver, kidney, bladder and even cancer of blood. Fifth one is impact on appearance. Chemical which is present in the tobacco damages the skin elasticity, also damages the collagen and elastin fibers, making the skin look more older. Also, it leads to the formation of wrinkles, yellow teeth, brittle nails, dull complexion and also damages hair. Sixth one is second-hand smoke. So when a person is smoking, even the people around him are getting affected. That is, the health of people around the smoker also gets affected. So when a person is in a place, or environment or air where there is smoke or burning tobacco products, it can affect health of those people. So if a person is smoker, not only he is the one who suffers, also your friends, family and children or people around you also have an impact on their health. And especially in children, they are at a higher risk to develop respiratory infection and asthma, and in adults there is increased risk of developing lung cancer and heart diseases. Seventh one is reproductive health. In men, it can lead to erectile dysfunction, and in women, especially if a woman smokes during her pregnancy, it can lead to premature birth, low birth weight, birth defects, and even infant death. Eighth one is addiction. So it leads to addiction, as I've already mentioned that nicotine is a primary addictive substance, and hence there will be symptoms of addiction and withdrawal symptoms are also seen. Ninth one is financial cost. So smoking not only drains your health or drains you physically and mentally but also financially. Smoking regularly can have impact on your finances, and also for treating the diseases which you have due to smoking, it will add up to your medical expenses. Smoking drains you financially as well. Next is how to quit smoking. First one is set a quit date and prepare. Choose a quit date. So you need to fix your mind and choose a date so that you get motivation and also so that you can prepare yourself for quitting smoking. Remove smoking triggers. Remove cigarette, lighter or any substance associated with smoking. Identify triggers. Find what triggers you to smoke, and once you identify the trigger, then you can avoid them. Second one is choose a quit method. So basically there are two methods. First one is immediate stop. So when a person decides that he'll stop smoking, then he'll stop smoking completely. This can be challenging because stopping smoking suddenly is a bit difficult, but if you're mentally prepared for it, you can do it. Next method is gradual reduction. That is, reduce the number of cigarettes you smoke every day until the day you completely quit smoking. This can minimize the withdrawal symptoms. Third one is develop strategies to cope up with the craving. Distract yourself. Engage yourself in any activity which keeps your mind and hands busy. You can practice a hobby or maybe exercising, sports, or any activity which you like to do. Deep breathing. It helps you to relax your mind, reduce stress, and also reduces the urge to smoke. Next is drink water, which will help to flush nicotine from your body. Substitute with snacks. You can have nuts or sugar free gums to satisfy your oral craving and keep your mouth busy. Fourth one is manage withdrawal symptoms, that is, mood swings and irritability. Tell yourself that this is normal to happen and it will subside in few weeks. Next one is trouble sleeping. So, if you have trouble in sleeping, then practice relaxation techniques before you sleep. Next is increased appetite. So, in such cases, go for a low calorie diet and also have healthy meals. Fatigue or lack of concentration. Have patience and take breaks whenever necessary and take adequate rest. Fifth one is build a support system. You can go for counseling or support groups, also family and friends. Surround yourself with people who motivate you to reach your goal and also who stand by you in your difficult times. Sixth one is celebrate milestones. Recognize your progress. Each day, each week, each month, when you go smoke free, reward yourself with something special. Track your progress. Use any app or journal to track your progress, which will help you to give motivation to move forward. Seventh one is prevent relapse. Identify high risk situation and try to avoid them, especially in the early stages when you're quitting smoking. Plan for setbacks. Know that setbacks are common and try to find out the reason why the slip happened and try to avoid it for the next time. Focus on health benefits. Constantly keep reminding yourself of the health benefits when you stop smoking. That is, your BP will be normal, your heart rate will be normal, the risk of heart attack or cardiac disease will be less, your respiratory health will improve. So, keep reminding yourself all these things. Practice relaxation technique. Eighth one is consider therapy, behavioral therapy. Counselor or therapist will help you understand your pattern of smoking, your trigger, and also will give you a strategy how to cope up with them. Practice mindfulness and meditation. Ninth one is exercise regularly. Exercising regularly will keep your mind fresh, relaxed, can reduce stress, and also will motivate you towards your goal. It will also improve your mood and reduce craving. 10th one is stay committed and positive. Remind yourself that why you have chosen to quit smoking and keep motivating yourself with all the health benefits that will follow once you quit smoking, and also remind that all the withdrawal symptoms will subside within few weeks. Next is how to cleanse and heal your lungs after quitting smoking. First one is stay hydrated. This will help to flush out all the toxins from your body and also is good for your respiratory health. Prefer herbal teas which can support lung healing. Second one is diet. Have diet which is rich in antioxidants such as berry, nuts, leafy green, which can help reduce the inflammation and repair cell damage in the lungs. It also fights free radicals, which is high in ex-smokers because of their exposure to smoking in the past. Anti-inflammatory rich food should be taken, that is turmeric, ginger, garlic, which can reduce inflammation in lung and making breathing easier and helps tissue repair. Vitamin C rich food, that is citrus fruit, strawberry should be taken as it will improve the immunity and also help in the lung repair. Food rich in omega-3 fatty acid is advised, that is walnut, flax seeds and fish. Third one is practice deep breathing exercises. So there are mainly three exercises which I'll be telling you now. First one is diaphragmatic breathing. In this you have to keep one hand on your chest, one hand on your stomach, and then take a deep breath. Allow your stomach to raise, and after some time exhale through your mouth. So do this slowly. It will help to strengthen the diaphragm and improve lung capacity. Next is pursed lip breathing. Inhale deeply and then exhale through a pursed lip. That is, when you whistle, how you make your lips, you need to do it like that and then exhale through your mouth. So this will help to keep the airway open for a longer time and release trapped air, making it easier to remove irritants. Next one is box breathing. In this, you need to inhale for 4 seconds, hold your breath for 4 seconds, and exhale for 4 seconds. This will help you calm your mind and also improve the lung function and lung capacity. So, do all these exercises slowly. Fourth one is exercise regularly. Mainly walking, jogging, cycling, swimming is very good for lung functioning. Start with light exercises and then gradually increase the intensity of exercise. Strength training also can be taken. Other than that, yoga and stretching. Certain yoga poses and stretches can improve lung capacity, strengthen respiratory muscle, and improve oxygen flow. Fifth one is limit exposure to lung irritants. Avoid pollution. Try to stay indoors in a place where there is pollution, or if you have to go out, then use mask. Avoid secondhand smoke. Being around smokers or being in an area where there is secondhand smoke can harm your lungs, so avoid that. Use an air purifier to reduce indoor pollutants, including dust, allergens, and other particles that could irritate your lungs. Next is ventilate your home. Keep the windows and door open so that there is circulation of fresh air. Keep indoor air clean. Vacuum, dust, and reduce pet dander to keep the air inside as clean as possible. Sixth one is try natural lung cleansing herbs and supplements like mullein tea or inhalation of eucalyptus oil. Seventh one is postural drainage techniques. In that first one is use gravity to drain mucus. Sleep on your back, stomach or side such that your chest is below the level of your hips so that it is easy for the mucus to drain outside. Second one is lightly tap your chest and back with the cupped hands so that the mucus get loosens and it is easy to cough up. Eighth one is practice good posture. Practice sitting and standing with your shoulder, chest and back wide open so that lungs get a larger surface area to breathe deeply. Stretch regularly. Stretch your chest, shoulder and back regularly to allow fuller lung expansion. Ninth one is get regular health checkups. 10th one is stay committed to a smoke-free life. Healing your lungs after quitting smoking is a gradual process, but it is possible to improve lung function and boost your respiratory health. That's all for today's video. I hope this was helpful. If it was, do share it with your friends and family and remember to subscribe to my channel and start your journey on being healthy. If you have any doubts or any questions, leave it in the comment section below. Thanks for watching. I'll see you in the next video. Until then, goodbye.